Hello, my name is Dr. Daviji and I'm going to demonstrate the head and neck exam today. This is our patient, Amy. Try and use a first name basis because you want to make your patient feel comfortable and at ease. And Amy, we're going to do a head and neck exam today. We're going to examine your mouth intraorally and we're going to look for signs of oral cancer. This is our armamentarium. You need a good source of light, a mirror to retract, 2x2 gauze to retract the tongue, and of course you need gloves and a mask. And remember, there's no more important safety equipment than safety glasses. Wear your eye protection at all times. So I'm going to put our mask on. Light source. Upside down. Gloves. Now, we'll start our exam. We'll look at our patient's face. We're going to examine the skin for any signs of skin cancer. You can look at the moles. We're looking for signs of melanoma. Remember your A, B, C, D, E. You're looking for asymmetry of the mole. Your borders have to be regular versus irregular. Color, variegation in color of a mole. D is the dimension if it's over 6 millimeters, and E would be if it's evolving, if it's changing. So you're looking at the signs of melanoma on the skin. Examine the ears, the neck. A lot of your patients have long hair. Don't be afraid to move the hair out of the way. Examine the earlobes. And skin cancer can appear as a non-healing ulcer or even a scar-like tissue for a morpheoform basal cell carcinoma. Okay. Also examine the eyes. Look at the pupils. Are the pupils dilated? Is your patient using recreational drugs? That may be a sign or a clue. You've taken your blood pressure already, so you know what the blood pressure is. Look for lesions in the eyes. You can look for redness of the eyes, Lisch nodules, some blepharons. There's all kinds of lesions you can pick up that you'll learn in your oral pathology course. Okay, now Amy, just tip your head back a little bit. We're going to examine the lymph nodes next. Submental, submandibular, cervical, either side of the sternocleidomastoid, preauricular lymph nodes, postauricular, occipital, and supraclavicular. Next, we're going to examine the temporomandibular joint. So we'll palpate gently and ask Amy to open wide, please, and close, and open, and close. And we're feeling for any crepitus, any popping, any pain or discomfort with opening, any limited opening, or any pathology that may occur in the temporomandibular joint. Now we'll continue on with our intraoral examination. So we're going to use our mirror. We have a disposable mirror and a good source of light. And just tip your head back a little bit, Amy. Okay, well, first we'll examine the lips, examine the vermilion border, look for any actinic keratosis, angular cheilitis, various other lesions. Evert the lips. We're looking for lesions. Palpate, feeling for masses or nodules in the lips. The cheeks, palpate the cheeks, the buccal mucosa. Again, we're going to palpate, feel for any masses, any nodules, look for lesions, striations. You can look at the fauces, the tonsillar pillars. Same with the floor of the mouth. Now, when you palpate the floor of the mouth, you have to support it underneath. Otherwise, you're just pushing down. And if there's a mass there, it'll just push down into the mental area. So you want to support the floor of the mouth and palpate. Now we're going to examine the tongue, and to do that you need 2x2 gauze because you have to retract the tongue to examine the lateral borders and the base of the tongue. And if you ask your patient if they've had an oral cancer screening and they don't remember the dentist retracting the tongue with a piece of gauze, chances are the dentist didn't do a thorough job. You need to retract the tongue and look at the base of the tongue. So Amy, just stick your tongue out at me. I'm going to grab it with this piece of gauze and I'm going to pull it to one side and we'll retract to one side. Look at the base of the tongue, palpate the lateral border, feeling for any indurations. Same with the other side. Palpate the lateral border of the tongue. You can swallow. Try not to gag your patient. And just tip your head back again, Amy. And now we're going to look at the tonsils and the tonsillar fossas. And just say, ah. Good. Okay. And that consists of your head and neck exam.